Hi everyone. So I've seen so many patients struggle with taking their drugs correctly, especially with respect to dosing intervals. So today we are going to talk about taking your drugs at the right time because proper timing helps ensure that your drugs work effectively and safely. Now, when a doctor prescribes a medication, they will usually specify a dosing interval. That is how often you should take that drug. The most common dosing intervals that we have are the once daily dosing, which is the drugs that are supposed to be taken after every 24 hours, the twice daily dosing, or every 12 hours, the ones that are supposed to be taken 12 hourly, the three times daily dosing, which are the drugs that are supposed to be taken after every 8 hours, and the four times daily dosing, that is drugs that are supposed to be taken after every 6 hours. It is very essential to follow these instructions or these intervals to maintain a consistent drug levels in your body. Now, one of the challenges that most patients face is adjusting to a convenient time. Now, let's talk about adjusting your dosing schedule to fit your daily routine. Here are some tips that you can use or you can follow to make it easy for you. The first one is taking your drug with a daily routine. You can link your medication or a drug to a daily activity like taking it with your breakfast or before bed, even though there are exceptions to this. All right. So the second tip is choosing a consistent time. You can pick a time that works best for you and you stick to it. Now, the third tip is using a reminder. You can decide to set alarms. You put a note on your fridge or your cupboard, or you can even ask a family member to remind you whenever it is time for you to take your drug. Then you can also consult your pharmacist or your doctor if you need to adjust your dosing schedule so that you ensure that it is safe and effective.